Hi, everyone. Thanks for joining us tonight for our face-to-face health webinar on autism and diet. I'm Dr. Jaimie Shanawaz. I'm the medical director here at Face-to-Face Health. It's nice to have you again this evening. For those of you who are not familiar with face-to-face health, I just want to spend a minute introducing our platform. We are a digital children's health and wellness holistic healthcare platform. And what that means is that using our platform, you can get any kind of care, whether it's traditional medical care, pediatrics, nursing care, through to developmental care, OT, PT, speech, as well as mind-body nutrition, which includes yoga practitioners and emotional regulation experts, all the way through to education and advocacy with teachers, play therapists, and the like. We also have a whole host of mental health counselors on our platform. So we're very excited to be able to offer this kind of collaborative team approach to your children's healthcare. So tonight, as you know, we are delving into the realm of autism spectrum disorder and its association with diet. And helping me tonight is one of our amazing providers, registered dietitian, Miss Jaimie Lafferty. Hi, Jaimie. Thanks for joining.
Hi, Jaimie. So excited to be here.
Absolutely. Jaimie, you've actually helped us out with one of these webinars before, and we loved having you. So I'm excited to work with you again tonight.
I'm happy to be back.
Thank you. So a little bit about Jaimie. Jaimie is a registered dietitian and certified lactation counselor. During her career so far, she has utilized medical nutrition therapy and individualized diets to help patients with a range of challenges, from weight management and chronic health conditions like diabetes, heart disease, kidney disease, all the way through to food allergies and sensitivities. While she has worked with patients of all age groups, she's most passionate about children's as well as obviously maternal health. She has completed the leadership in education for neurodevelopmental and other related disabilities, otherwise known as the LEND program, in which healthcare professionals learn how best to help families who have children with disabilities. Much of her focus actually lies in research and has more recently run a research study looking at the nutrient intake and mealtime behaviors of children with autism spectrum disorder. So I couldn't think of anyone better to help us out tonight.
Yes, I'm very excited to talk about that.
Yeah, so just to put tonight's talk into context, Jaimie, autism spectrum disorder, the latest sort of studies and the statistics that have been released by the CDC based on children aged 8 years old have shown us in this country alone, 1 in 54 children are diagnosed somewhere along the spectrum of autism. It is 4 times more common in boys than in girls. And the reason that I mention those statistics is because when we're looking at holistic healthcare, this is a large group of people that if we can serve in this way, it would really improve healthcare outcomes.
Absolutely.
Yeah, and diet is a big part of that, which is what we will learn. So I usually start off these presentations with a statement, which tonight is going to be, autism only affects the brain. Can you talk to us a little bit about this, Jaimie?
Yeah, well, we know that autism, by nature and by definition, it is a social, is a social disorder, an inability to maintain and foster social relationships may be characterized by repetitive behaviors. And so it's not just what's in their brain, it's kind of it's outward. It impact their lives in many different ways, not only just socially, but also with nutrition as well.
Right. And as we had discussed earlier, there are a lot of GI problems associated with autism as well. So again,
yes, exactly.
Mentioned a purely neurological disorder. Let's move on. There is no correlation between diet and autism.
Yes. So we know that this is not true. And actually, research tells us, one study that was published back in 2016, told us that, 80% of young children with ASD, had challenges with picky eating, and 95% of those children were resistant to trying new foods, which is one of the challenges one of the mealtime challenges that children with ASD tend to encounter. And also this population has the highest rates of general problematic mealtime behaviors compared to their neurotypical peers. And this population we know is also at the highest risk for developing nutritional deficiencies due to highly specific food preferences or aversions, and other challenging mealtime behaviors. And food allergies and sensitivities do play into this, and it can affect their gut, which may affect their mood, their energy level. And it's also, important to note that as a result, comorbidities may occur and develop, such as overweight and obesity, which I'll talk about a little bit later, that also puts them at risk for developing other conditions such as diabetes, high blood pressure, hyperlipidemia, joint problems, and so on.
Yeah, and I think often when people think about, the relationship between diet and autism, often we think in sort of a one-way correlation, which is if I change my diet, can it help with autism? But I think the thing here to realize is that because of the autism, there are specific dietary challenges. So it kind of goes both ways. And so really a lot of what we're going to be focusing on tonight is actually figuring out what those challenges are, identifying what those deficiencies may be, and then tweaking a diet around those, as opposed to instituting specific kind of across the board diets.
Yes, exactly.
Okay, so in your experience, you would sort of just very briefly mention, given a nice summary of the challenges that you have come across. Let's move on to the specific challenges that you've seen in your experience, also, and particularly in your research.
So some of the specific challenges that I've seen are, one of the factors is receiving feedback on feelings or preferences when it comes to foods. And so, especially if you have a child who's nonverbal, this can be challenging because, as you're feeding your child, you're not really sure how they're feeling with certain foods, and they can't really give you feedback. So I think, especially with a child who's nonverbal, and can't really express how they're feeling, it's important to maybe track their behaviors. And so, after a meal or after offering certain types of foods, just pay attention. Maybe your child's doing a behavior that they don't usually do. And so that can be kind of your feedback. Also, a way to track, how they're doing, how their diet is going is also through their stool. So you can keep like a stool log, and so kind of track the size, shape, consistency, and color of their stool. And so this can tell you a lot about how their food is being absorbed. Can also tell you about how they're feeling, because for example, if you're noting that your child is having a lot of diarrhea, that they can't probably feel very well. So this is like another thing that you can do. We do know that as there is no diet for autism, because we know that the origin of autism isn't dietary, getting your child tested for any food sensitivities or food allergies can be important, because improvements in their gut can actually make them feel better and may have potential positive behavioral outcomes. And research tells us that if your child does have a severe deficiency, improving that deficiency, there is the potential for having improved behavioral symptoms.
Right. So in terms of, there are, I guess, some simple home tools that you can use for children who are nonverbal, stool logs being one of them, as you mentioned, behavioral logs being another. And then what you're mentioning is that perhaps one of the things that we should do early on is also get the nonverbal kids to actually be tested.
Yes. And, and that's also something I would recommend, for those who are verbal as well, just to kind of get like a clean slate, kind of figure out what's going on. So that way you have a full picture as to how you can help your child.
Right. And Jaimie, in the ideal world, kids are diagnosed around 2 years old. So are we talking about testing at diagnosis, or because obviously, as we know, all the research has shown that, early intervention, ages 2 to 5, really is associated with better outcomes. So we're obviously talking about testing kids at a younger age.
Yes, absolutely. And the earlier the better, because, if there is a scenario where there is something going on, the earlier that you can catch it and the earlier we can treat it, the better the potential outcomes are. So absolutely.
Absolutely. Can you talk to me a little bit more about the feedback on the physical discomforts, allergies? Allergies, I guess, is fairly obvious if your child is having an allergy, but there are some subtle ways that allergies do present?
Yes, absolutely. Paying attention to their skin can be a great way. So they develop any sort of maybe small rashes, little bumps. Dry skin can also be an indication of some sort of reaction. So just skin integrity, skin quality. How does it look? And also maybe tracking that. If you're a parent who is trying to currently figure out what's going on with their child, you feel that there's something, either, maybe they have a rash or they're kind of having symptoms. So tracking, how their skin looks after certain foods or meals can also be a good way to try to get more information, if you were to go to your physician, dietitian, and the more information you can give them, the better in terms of trying to figure out what's going on.
Yep, absolutely. You had touched on nutritional deficiencies. I think we're going to go into that in a little bit more detail later on, right? So let's talk more about the GI symptoms then.
Sure. So we know that there's a higher prevalence of GI symptoms among children with ASD as compared to children with neurotypical development. And some of those GI symptoms include constipation, diarrhea, and GERD, or gastroesophageal reflux disease, just to name a few. So to start with constipation, as we know that children with ASD tend to have more of a limited diet that does sometimes exclude foods like fruits, vegetables, and potentially whole grains, depending, but more so the fruits and vegetables where you're going to be getting a lot of your fiber intake from. And so it's important to try to find some ways to increase the fiber in your child's diet. So, it can be ways you can try to make a smoothie, you can throw fruits, vegetables. It's a great way to incorporate a lot of things that you wouldn't normally be able to feed your child, especially if they're very picky. And so here we have some fiber recommendations. So for children, ages 1 to 3, they start out needing a little bit of a lower amount of fiber, but as they get older, the fiber amount does increase. And if you want to go to the next slide, does that mean?
Sure.
So some of the sources of fiber can, be fruits and vegetables are great sources, also grains. So for example, a small apple gives you about 2.5 grams of fiber. A medium orange gives you about 4 grams. And so if you're feeding your child a varied diet, there's a good chance that they're going to be able to meet those dietary recommendations. Where the challenges come in is when your child does have very specific food aversions or food preferences. And so that's kind of when you might want to bring more of a team involved to try to figure out, how can we improve your child's diet.
Right.
And
sorry, just to interrupt, I just realized if any of you do have any questions, we're more than happy to answer your questions. So please keep your questions coming. Sorry, go ahead, Jaimie.
I was going to say, another thing to do, another thing that can be great to do to try to but incorporate more fruits or vegetables is, for example, if you're making like a pasta, sauces are great ways to hide vegetables. So if you're making, your child will eat spaghetti and meatballs, in that pasta sauce, you can hide spinach, carrots, celery, onions, and as long as it's not an issue of taste, if it's just kind of a visual seeing the food, you can hide a lot of foods and incorporate a lot of different vegetables. And so another piece to this is ensuring that your child's adequately hydrated. So to prevent constipation, you do need to make sure that your child is getting enough water, enough fluids throughout the day. It's interestingly enough, about 20% of our water intake comes from our food. So it makes sense that, if your child is highly selective with their foods, that actually does decrease the amount of water that they're getting, especially if they're not very agreeable to drinking fluids like water. And so when that happens, some of the things that you can do is try to water down juice. So do a half a cup of juice, 100% juice, fruit juice, and then half a cup of water. Smoothies are a great way to offer vitamins and minerals, but also increasing fluids. So moving on to diarrhea, depending on if your child's on multiple medications, maybe due to behavioral challenges, we know that medications may impact diarrhea. Sometimes it may be due to a food intolerance or food sensitivity. And so that's another reason why it's really important, especially early on, to try to figure out if there's anything that your child is sensitive to. That's not to say that there can't be a food that you maybe haven't offered your child very often, and you find out that they may have a sensitivity to it, in which case, logging is very important for that. But to help with diarrhea, a possible low fiber diet during the time that they're experiencing the diarrhea can be helpful. And so a low fiber diet may include maybe foods like applesauce, bananas, vegetables like asparagus, green beans, and then choosing grains that have lower fiber just during that time that they're experiencing the diarrhea. So that way, it, kind of hopefully will calm down their GI tract and it will subside. Another thing that can help is it reducing or removing foods that are fried or highly fatty, removing spicy foods, and also if your child likes sugar-free gum. I know it's not something that we all think about, but sugar-free gum, sugar-free candies, they have artificial sweeteners that can actually exacerbate some GI symptoms if your child is experiencing diarrhea. So that is.
Yeah, in terms of, and again, this kind of goes back to the specific challenges, we're almost talking like about a restrictive diet. There are certain things that these children do want to avoid. Can you just tell us a little bit about why they kind of avoid certain foods?
Yeah, so absolutely. So when it comes to avoidance of certain foods, a lot of it may have to do with atypical oral sensitivity. And so more or less, that's just your child kind of is having a strong aversion to certain tastes or flavors. And so that's restricting their desire to consume a wide variety of foods. And so it can also have to do with maybe colors or textures. So some children with ASD, the common one that I mentioned earlier is fruits and vegetables, but for some children it's meat, and they're not comfortable with the sensation in the mouthfeel of meat. So a lot of it has to do with that sensitivity.
Okay, great. Then just moving on to GERD.
Yes. So moving on to GERD, or gastroesophageal reflux disease, or reflux. So this can manifest in many ways. So this can mean, after meals or during meals, your child starts vomiting. At some point, your child develops chest pain, heartburn, or they may refuse foods. And that may be because it's not making them feel very well. It's causing, the food to come back up. And so a diet for GERD may include, avoiding highly acidic foods, maybe low amounts or, reduced amounts of tomato products, greasy, oily foods, processed snacks. And also, you might find that your child has unique triggers for their GERD. So that's another great reason to keep a log, especially if you're early on trying to figure out what's going on, or if you have a newly developed issue that you're trying to resolve.
Right. And of course, things change as well. So it's always a good idea to map out, right, changes.
Exactly. Mm-hmm. And even, we know that with food allergies, food sensitivities, they can also change over time. So they can improve over time. So, you might not have the same problem. Your child may have the same problem they did when they were younger, versus when they're older. So again, keeping logs are a great way to kind of track that, especially to figure out what's going on.
And one of the other poorer health outcomes that, again, is the weight gain and obesity, and the difficulty in kind of keeping to a healthy diet.
Yes.
So, which is not something that we often think about, but I think there are some very convincing statistics around this.
Yes. And, unfortunately, this is a challenge in this population. And a lot of it has to do with the sensory issues, so oral sensory issues surrounding foods. And so because many children with ASD are less likely to consume these fruits and vegetables, they're more likely to consume the highly caloric dense foods, such as maybe processed carbs, other processed foods, which tend to be more dense in calories than it does in nutrition. And so that's kind of how it contributes. And so the prevalence in obesity in children with ASD is similar to the US population. It's about 18.5% of children ages 2 to 19 years old are obese. And then there is an even higher prevalence of overweight in children with ASD, and 16.6% of children in the US ages 2 to 19 are overweight. So as a result of those food preferences, it can kind of lead them down a path that, you know, may end up in a little bit more weight gain. So managing weight can definitely be a challenge.
Yeah. Okay, let's move along. I just noticed that it's pretty obvious that I think you did the header for this slide, and I obviously did the rest of it because we have the American and the English of fiber on this slide.
We do.
I don't know if anyone picked up on that. Okay, so this is what I'm really looking forward to discussing with you, because this is your niche. You spent quite a bit of time researching this, and this is what I think a lot of parents and caregivers really struggle with. So we may have all the best intentions, but to put all of this into practice is really hard. I do see that there are a couple of questions, and I will get to those as well. So Jaimie, tell us about your findings.
Sure, absolutely. So I'll start out with just a bit of a summary of my research, and I'll kind of get into some of the more specifics we have on the slide. So my research was involving children with ASD as compared to neurotypically developing children. And what I looked at in my research was the prevalence of problematic mealtime behaviors and the nutrient intake of these children. And so what I found was that children with ASD had a higher prevalence of nutritional deficiencies, and the correlation was that the greater the number of problematic mealtime behaviors was the greater risk for them to have nutritional deficiencies. And more or less, the study that I conducted, we used a questionnaire that's highly validated in the ASD population. There aren't very many questionnaires that are actually validated that assess the different problematic mealtime behaviors. And so just to kind of start to kind of outline some of the common eating and feeding problems that children with ASD may experience. So this may include food refusal. So this can be, you know, an inability to, or refusal to eat certain foods. So food selectivity or restricted food take, which is exactly as it sounds. Also, you know, some tantrums or aggression during eating and during the feeding times. Rumination and pocketing, so regurgitation of food and either re-swallowing or spitting it out. You know, maybe swallowing problems or chewing problems. Pica, which is the eating of non-food items, non-nutritional items, can be a challenge. And then also overeating or undereating. So with the picky eating, while they may tend to eat certain food groups, which may cause weight gain, they also may not eat enough at the same time. So there's also the challenge between making sure that they're at a good weight, not only are they gaining too much weight, but also making sure that they're not losing too much weight because of a poor appetite. So that's kind of some of the behaviors.
And poor appetite is related to, I guess, everything else that's going on externally around the food.
Yes, and so that's another component that I don't think I've mentioned is the environmental factor. And so children with ASD are very sensitive to their environment. So, and again, every child is different. So some meal times, you know, if the severity of your child's ASD isn't too great, you know, they might be fine eating dinner with the family normally, but they also might require, you know, being fed separately, you know, without any distractions in a more calm, you know, environment. So I think environment, I don't think we have a bullet on this, but I think environment is a really important factor to take into consideration as you're trying to navigate your feeding challenges, you know, with your child.
And so I just want to ask, these sorts of behaviors around mealtime, is it more to do with the severity of the ASD, or is it age specific, or is it both? Is there any patterning that you're seeing that parents can look out for, or expectations?
So it seems to me, from what I've read in the research, is that it has a lot to do with the severity of the ASD. So we do need more research to kind of back this up, but from the research that I have read, it does seem to have a great impact based on the severity. So the greater the severity of the behavioral symptoms at meal times, the lower the amount of the nutrients that we would want them to have are in their bodies, more or less. And so I also did find that in my research, and my research was kind of like a preliminary because we were still recruiting at the time. So, take it with a grain of salt, but, it is food for thought in terms of the fact that since this has been popping up, not just in, my preliminary research, but in other studies, that it does seem that the severity of autism does have a great impact on the severity of nutritional deficiencies and the amount that they're getting.
Yeah, I think there's a lot of research out there on this now in more recent years, and I think it's all pointing to in the same direction as what you're saying.
Yes,
and it instinctively makes sense as well. So talk to us about sort of the types of nutritional deficiencies that we do commonly see in ASD.
So some of the most common ones that we see are, vitamins A, B12, and so B12 is commonly found in meat. There are some vegetable sources, plant-based sources, but most of us get most of our B12 from eating animal proteins. And so for children who are averse to the textures of meat, this can put them at risk for a B12 deficiency. Vitamin C, vitamin E, vitamin D, also minerals such as zinc, iron, calcium, phosphorus, and potassium. So a lot of these vitamins you can find in fruits and vegetables. And so that kind of ties back to the, what I've been mentioning multiple times so far is that foods that have a lot of texture can be problematic for children with ASD. And so as a result, it puts them at high risk for these deficiencies. Also, because as I mentioned, in issues with textures, maybe with meat, can also put them at risk for, being deficient in protein and making sure that they're getting enough protein, but also fiber. So, there's multiple nutrients here that are involved. And, one study that I found showed that 71% of the children with ASD in their study group didn't meet the nutritional recommendations. And this is actually consistent with other research that I have read in my own research, that the children with ASD as compared to neurotypical development, they did not meet the nutritional recommendations.
Okay. So actually, before we move on to the second half of the talk, we have a whole bunch of questions. So let's answer a few of those, and then we can move on. So I'm just kind of skimming through them. Is there any link? This is from Mary. Is there any link to obesity and medications and lack of physical activity with ASD and children?
Let's see. So linked to medications and obesity. So yes, actually, we, depending on the severity of ASD, any other comorbidities that your child might have, they can be on medications that might cause them to want to, have an increased appetite and can cause weight gain. So that is a challenge in of itself. And so as a result, we know that once there's excessive weight gain, that puts them at risk for more comorbidities. And so could you repeat the end of that question?
Yeah, absolutely. And of course, that's the whole spectrum of lack of physical activity.
Oh yeah. So, and again, I think that also kind of depends on the severity of the ASD and if they have any other disabilities. And so I think that kind of depends from child to child, especially how willing they are to be physically active. Can they, do they have any mobility issues and so on. So.
Okay.
That answers the question.
Yeah. Mary, I hope that answers your question. Please, send me part 2 if not. These are some more specific questions, Jaimie. My son had a bad season last winter with diarrhea, and we ruled out GI issues. So how can we tell how it's viral versus a gastro issue?
That is a great question. I'm not sure I can specifically answer. I feel like that's something that bringing the interdisciplinary team into the picture, I think could help, because you can get a bunch of different opinions, different perspectives, and possibly try to rule other things out, in a team setting. So I would recommend bringing in a team and trying to figure out what's going on.
Yeah, and if I'll just pop in my 2 cents worth as well there. I mean, just in terms of the clinical presentations, often a viral infection will be quite different to, say, a malabsorptive issue that's due to a gastro problem. So often you'll find other symptoms along with a viral infection. So the child might be feeling just generally unwell. They may have fevers, they may have sweats, they may have abdominal pain. So these are the other sorts of symptoms that you would want to look out for with a viral infection, which is often kind of an acute onset as well. But definitely that is something to take to your pediatrician. And as Jaimie mentioned, if viral infections are ruled out, then other issues would have to be looked at. So I hope that answered your question. Yes, you will be able to get access to this presentation. So all attendees for tonight will actually receive this recording as well. So you can always take another look. Can we get some ideas of how to help a child on the spectrum with holding their spoon, especially if they have poor muscle tone?
So that is a great question for an occupational therapist. Yes. So an occupational therapist can kind of work with your child to figure out what maybe adaptive equipment that your child needs to be able to eat independently at the table. So, if there's any other chewing or swallowing issues going on, it would bring in, speech language pathologist, and then potentially, a dietitian as well. But I think immediately, I think it would be great to speak with an occupational therapist.
Absolutely. And autism spectrum is one of those conditions that does so well if there is a multidisciplinary team. And often that team does, require an OT as well as I would think this particular child may also benefit from PT as well. Mm-hmm. So speech language, PT, OT, they're sort of the developmental spectrum. And then of course we have dietitians with diet. So in terms of muscle tone, as Jaimie said, absolutely, that would be an OT question. And we actually have lots of OTs on our platform. So you can always look up occupational therapist at face2facehealth.com. And we have plenty who actually work very closely with autism spectrum. The next question is, my son is obese and incessantly asks for dairy, milk, yogurt, cheese. He will continue to ask and escalate until he gets it. What can I do to curb that? He won't drink almond, oat, or soy milk. It's tough.
Yeah, that is a very, very tough situation. My immediate thought would be, if he would possibly accept any 1% or fat-free dairy, if there's no way to avoid giving him or dairy or providing dairy products, choosing a lower fat option would be more preferable. Also, attempting to offer smaller portion sizes when he asks can be another way to mitigate it. Again, I'm not sure of the specifics on the dynamic, but if you could potentially, if he wants cheese, offer half a cheese stick, and then maybe when he wants it again later, give him the other half. So that's something that I feel you would benefit greatly from talking to an RD, because they can kind of get in all of the other pieces of information going on surrounding, your son's eating habits, and kind of come up with more specific solutions for him. But possibly offering smaller portions when he does ask. Another thing is that, if he's asking a lot for yogurts, offering plain vanilla yogurt versus having fruit yogurt. Fruit yogurt tends to have higher amounts of sugar and carbohydrates. So offering a plain vanilla version can be better. So there are some things that you can try if you haven't already, but also, I would recommend chatting with an RD.
Yeah, and Jaimie, what you're actually talking about there is something that we will touch on later on in the talk, is how to actually introduce these sorts of dietary changes or these behavioral changes. And I think what you were getting at was this concept of weaning, sort of smaller and smaller amounts of something that you want to maybe perhaps cut out altogether. So we do have a few more questions here, but perhaps we'll save those till a little bit later. Let's mix it up and get back to the presentation. I hope that answers your question, Andrea. So Jaimie, let's move on. There's been a lot of talk and a lot of research around diets, specific diets, and autism spectrum disease. The hope is that there's something out there that we can do that will just mitigate all of these behaviors. Putting my child on a certain diet will cure his or her autism. Myth.
So, it's a very tough idea, that just changing their diet will fix everything. And what I would like to say about that is that, if your child truly does have an allergy or sensitivity, or have a very low deficiency in a nutrient, improving that may actually improve the behavioral symptoms. So it's not a guarantee, so it's not going to cure their autism, but kind of bringing your child's body back up to where it needs to be and where it should be can make them feel better and may have a great impact. So that's what I'd like to start off with that.
And so there are 3, I guess, commonly associated diets with autism that have been researched, at least.
Yeah. So starting off, so a gluten-free, casein-free diet. So just to give a little bit of a background as to why this is thought to be helpful, is that the thinking behind this diet is that children with autism, they have more sensitive GI tracts, and so and the thought is that the gluten and the casein, they're more difficult for them to digest, and by cutting them out, it'll improve behavioral symptoms. So when it comes to this, so this is a diet that has not been researched. There is not research on a gluten-free, casein-free diet and its efficacy in children with autism. However, there has been research done on a gluten-free diet in children with autism. And what they found is that the children that had celiac disease, those children had the greatest improvement in behavioral symptoms. And that was as a result of the celiac disease. And in the children that didn't have celiac disease, there were no difference in behavioral symptoms. So this kind of goes back to, if your child really does have an issue with a food, like, in this case, it would be gluten with celiac disease, improving their diet by cutting out gluten, while even though it's restrictive, it actually will allow your child's gut to heal and can make them feel better. So this diet has been researched. We know that a gluten-free diet is effective in children with celiac disease and in individuals with celiac disease. And so I think it's important to just keep in mind that your child could also have a sensitivity. So again, that's kind of where getting tested can kind of come into play. But if you suspect that your child has a sensitivity, I think that's great to bring in RD and get involved, because they can help you safely eliminate foods from your child's diet while also monitoring the amount of nutrition that they're getting. So that is the gluten-free, casein-free diet.
Sorry, before you go on, Jaimie, you'd mentioned sort of the gluten. I think that casein sensitivity is, in terms of how common it is, it would be much less common than gluten sensitivity.
Yes.
But we're talking about similar symptoms, right?
Yeah. So, a casein sensitivity could result in similar gastrointestinal symptoms. So it could be gas, diarrhea, bloating. So it's not to say that your child couldn't have, a casein sensitivity. If you suspect they have a gluten sensitivity, it's not impossible to rule out that it could be a casein sensitivity. But again, that's where getting tested comes into play. But and also just paying attention to how your child acts, feels, visually looks, but observing their abdomen after meals and taking all that into consideration.
Yeah, and I just want to point out that if you do actually introduce a GFCF diet, these diets take months to really kind of come into play. So, once you take your child off gluten, it takes 3 months for the intestinal lining to really heal. So just keep that in mind. And I just want to add in here that, I think there's also been a lot of anecdotal evidence from, caregivers, professionals who have used this diet and sort of noticed that there has been some improvement. And I think you and I were talking earlier that this could be due to a number of different reasons, but all kind of coinciding together.
Yes, exactly. And just to touch on what you just mentioned, is that, these diets do take a while to work, to fully to see a difference, especially if it really is the true cause of your child's GI problems. And so patience is very important. And also, especially with celiac disease, strict adherence to a gluten-free diet is very important in order to see true effects.
So can you tell us about the Feingold diet, please?
Sure. So the Feingold diet, or also known as, cutting out and reducing all refined sugars. So the thought behind this is that reducing added or refined sugars can help improve any GI symptoms that your child's experiencing. And, as we know, that highly processed foods that have a lot of added sugars, they're not going to leave your child feeling their best. And so we know that high amounts of sugar in the diet can result, again, in negative gut health, can cause GI symptoms, gas, bloating, can negatively impact your child. And it's interesting to note that this diet was also used in the 80s to try to help children with attention deficit disorder. And what we know now is that there's no relationship between the amount of sugar that your child consumes and their hyperactivity. However, it is important to note that if your child is consuming a lot of refined sugars, it can negatively impact their gut. And depending on if their child is verbal or not, they may express that in different ways. But it's not necessarily saying that sugars cause hyperactivity, or reducing or cutting out all added sugars are going to improve behavioral symptoms in your child. So I think that's another one of those things that is a trial and error. Every child is unique and different and reacts in a different way. But it is, in the concept of reducing sugars and reducing processed foods, I think is good. But when you say sugar, that's kind of a general term. So sugar is carbohydrate. There's carbohydrates in pretty much everything that we eat. Even vegetables have carbohydrates. So it's also important to know how to define, added sugars and whatnot.
Right. Okay. And then last but not least, the GAPS diet, which I think is an incredibly difficult diet to.
Yes. So this is another diet that has not been researched. It was developed by a psychologist, and more or less it stands for gut and psychology syndrome. And the premise of it is that by eliminating grains, pasteurized dairy, starchy vegetables, refined carbs, it is going to improve your child's behavioral symptoms. And so the thought is that children with ASD may have a more sensitive guts. And so as a result, they may have a leaky gut, which means that the permeability, so the ability of nutrients to pass between the lining of the intestinal wall it's kind of looser in kids with ASD. That's what the thought behind this diet is. And that by reducing certain amounts of food for certain foods from the diet, it reduces the toxicity that they're getting. And so there is no research behind this. Again, it's not to say that every family is different, every child is different, and you find that after reducing certain foods from your diet, your child seems to feel better. By all means, I would never say don't do something that's helping your child, but I think it's also important that if your child is on a restrictive diet, to make sure that the child's being monitored to make sure they're not going to be at risk for deficiencies. And another thing to note about this diet is that it can have some side effects, such as like diarrhea, bloating, gas, constipation. And so just be aware of the fact that the more restrictive a diet can be, it can have negative side effects.
Right. And I think leaky gut aside, the underlying idea also is that that there is a higher incidence of just gut inflammation in children with ASD. And perhaps this is why some of these kind of reduction type of techniques actually work.
Yes. And the other thought is that that these foods that contain toxins are causing some sort of brain fog or some sort of impairments in their thinking and whatnot. And so the only research that we do know is that, in terms of celiac disease, one of the symptoms of celiac disease can kind of be a brain fog. But outside of that, there's not much research in terms of foods causing, preventing you from thinking clearly and whatnot.
Yeah. But I do appreciate what you said, is that each child is unique, and each family circumstance is unique. And so, if there are any subtle signs there, it's definitely worth investigating, and then
absolutely
trying some kind of dietary change, right? One of these. Yeah. Okay. Let's move along. In fact, let's go to some questions.
Sure.
This is from someone. I use elderberry immune support for my son because he cannot chew vitamins in any form. And actually, that is something that we should touch on, is vitamins and supplements. And this would be a great segue. Is this enough for his overall health?
So I would need a bit more information for me to know if that's enough. So, if your child accepts a wide variety of foods, and they're not too picky, they'll accept, some fruits, some vegetables, they'll accept some protein foods, whether that be plant-based products, which is totally fine. So like soy products, tofu, soy milk, et cetera, or whether it be like actual animal proteins, so meats, turkey, ham, beef. If he's accepting a wide variety of foods, in addition to a nutritional supplement, I would say that his diet is probably adequate. But if his diet is very restrictive, then I would say that that's something that you might want to have a chat with NRD about, just to make sure that they can analyze his diet and see what nutrients he may be at risk for not getting enough of.
Yeah. So just talking about vitamins and supplements, what brands would you recommend?
So
favorite?
My go-to is, if your child can chew and will accept foods via mouth or vitamins orally, Flintstone vitamins are always great. They provide pretty much, it's a great multivitamin. I would like just to point out, and again, this is a population where whatever works. So by no means stop what you're doing, but if you can get your child to swallow a hard vitamin or even a chewable vitamin, that's going to give them more nutrition than, say, like a gummy vitamin. But if that's the only thing your child will accept, that's perfectly fine. It's just important to know that the absorption of gummy vitamins versus like hard vitamins or chewable vitamins is not the same. So just some information.
This is a question from Dorothy. I have heard that high fructose content can cause symptoms such as diarrhea. I gave grapes one time to my son and he got diarrhea.
So this sounds like it could be an individual problem. So it could be, I think this is one of the things where, I do need a bit more information, and sometimes GI symptoms aren't as a result of something that your child eats immediately. It could be, but a lot of times when your child's passing stool, it's not the last meal they ate. It's probably the meal before the last meal that they ate. It's, between 12, 24, even 36 hours after a meal that your child is going to pass their stool. So, assuming they're healthy, it should be, the transit time should be relatively quick, but, again, it's not going to be that last meal that they ate. So keeping some sort of food log would be great. As long as he didn't have any sort of like swallowing issue or choking anaphylactic problem, trying the food at a different time, maybe if you've tried it multiple times already and kind of know that's causing him problems, then, by all means, it might be that. But I think keeping a log could be important because it may be something else in his diet that causes his diarrhea.
Right. And in terms of fruits and fructose, I mean, you have high fructose contents in other fruits as well. So It may not be the fructose, it may be the grape, something more.
Exactly. It might be something unique to grapes that your child is sensitive to. So
yeah. Yep. absolutely. We have, let's have a look. Another question here. Do you have any suggestions for children whose parents are vegetarians or vegans when it comes to the vitamin B deficiency? And that's from Courtney.
All right. So vegan, vegetarian, plant-based diets. I always love hearing that. It's a great way, to maintain good health. There's been a lot of research showing the efficacy of plant-based diets and the reduced medical conditions and developments and just overall general health. So that's great to hear. In terms of I'm sorry, can you repeat the question?
Vitamin B. Vitamin B.
Yes, thank you. Yes, so there are some plant-based sources of vitamin D. So mushrooms have, in terms of B12, I guess that was what she's talking about. So there are some plant-based sources, but typically to make sure that your child's getting adequate amount, a supplement of B12 could be beneficial. Whether that they're a child or an adult, consuming a plant-based diet, is really great. But because most of our B12 comes from animal proteins, getting it in plants can be challenging. So in that case, I would say, maybe consider a supplement. Also try to, increase the variety of foods that, you're feeding your child. But in terms of B12, a supplement does usually do the trick, and then you don't have to worry.
Yeah. I just want to say, I'm kind of going back to the question we had where our audience member possibly could have benefited from seeing an OT. Courtney is actually one of our amazing OTs on the platform. So it's nice. Yeah, it's nice to see her on. We do have one other question from Dorothy. I'm not entirely sure if I'm fully understanding. Is there any evidence that a viral infection for ASD children can have diarrhea or constipation? I'm not entirely sure. Maybe Dorothy, if you could just send us a bit more information about that one. Not quite sure where we're headed for that one. Is eating eggs give a child enough B12? So eggs and B12 content.
Eggs alone, eggs are a good source of B12, but eggs alone aren't going to provide enough. So that's kind of where you're gonna have to try to balance it with other foods as well. Great. And possibly supplement, because it is difficult.
Okay, we are starting to get to the end of our time. So Jaimie, I just want you to go through, if there were 5 things that you wanted us to walk away with tonight, what would they be?
So number 1, I would say that we know that children with autism are at an increased risk for developing nutritional deficiencies. Number 2 would be that the diet's often restrictive. So due to food aversions, preferences, and challenging mealtime behaviors, navigating that can be difficult. And to tie it back into the first point, just making sure that you're aware of, if your child does have a restricted diet, making sure that they're getting, that they are being seen by an RD, and making sure that they're getting tested. So that way, we can make sure that we can keep on top of any deficiencies. Also, testing early as possible for food allergies and sensitivities and nutritional deficiencies. I would say number 4 would be, use simple charts to kind of track your child's symptoms. So especially, if they are nonverbal, it can be difficult to kind of know if something's affecting them. And so kind of tracking their behaviors, noting if there's anything that they're doing that they don't normally do, it may be related to something that's going on in terms of their, GI feeling, and whether it be gas or other discomforts. And I think the other thing to keep in mind, again, with blood tests and making sure that at least, once or twice a year, it doesn't hurt to get your child checked in terms of checked what their vitamin and mineral levels are, even if they are healthy, just because of the fact that they are at higher risk. And so it's good to be on top of it. And then lastly, I would say, just keep in mind, while it is difficult, there is no dietary cure for autism, but treating deficiencies and assessing mealtime behaviors can lead to improved quality of life, and may result even in improved behavioral symptoms, because your child is just feeling better and they may have more energy and they may be feeling more like themselves.
Mm-hmm. And Jaimie, can I just ask you, for a parent who is concerned about their child's diet, that they may have nutritional deficiencies, what would you recommend as the first steps? Would they necessarily come directly to a dietitian? Would they see their pediatrician? Where do you get referrals from generally?
So, seeing your pediatrician can be, a great start, just making sure there's nothing underlying that's maybe causing those deficiencies. Also involving a dietitian may also be a great first or second step, depending, if you've already been to your pediatrician. Going to an RD next can be a great thing. And they can go over, their nutrient panel with you and kind of go over the foods that your child will accept and how you can incorporate those foods into your child's diet to improve or prevent, further deficiency.
Great. You are very popular. I'm just going to stop this for 1 minute, and let's see if we can just really quickly get through a couple more questions. Actually, the follow-on question was, my son had diarrhea and it was attributed to a viral infection because we ruled out a GI issue. Okay. All right. So I think that was just kind of a, closing that conversation that we were having earlier about viral versus GI issues. And then we just had another question in terms of how soon after eating a food should we check for the behavior? That's a tough one.
So I feel like this, because autism is so unique child to child, I feel that that's something that, the child parent kind of would just be in tune with, because, a parent is going to know if their child is doing a behavior that they don't usually do, especially if it stands out. Sometimes it might not stand out. I mean, and the thing is that it's hard to know. And, just understand that, you can do, as best as you can, but there's some things that we won't know. So, but just be alert, be aware. I don't know if there's a specific time period that I'm aware of that, you should check for symptoms, but just be on alert.
Yeah, and I think in terms of the physical symptoms, and again, this goes back to your emptying times, the transit times through the bowel. If you are keeping a stool chart, if you are keeping a behavior chart, and the whole point of keeping those charts is to notice a pattern of behavior.
Exactly.
So if you see that you've introduced a food and then suddenly over the next couple of weeks, that particular pattern of behavior changes, then you could potentially think that it could be due to that new food.
Yeah.
So it's data that's collected over a period of time, really.
And some of those things, pieces of data you might want to collect is, is your child making faces while they're eating their foods? Are they, making any noises and, maybe in pain? Are they crying? Are they, that those can be simple things to keep track of, especially while trying to figure out what's going on.
Right. And I presume as a dietitian, you would probably ask for those sorts of charts for a parent to do, right?
Yes.
As homework.
Yes.
Okay. So Jaimie has very kindly shared a couple of her favorite resources for all of you. If you do require more information, Jaimie, is there anything you want to quickly mention about the first couple of resources there?
So the first one is the CDC came out with a very nice milestone tracker. So this is great to kind of track your child's development. You can, when you download the app, it's free. You can put in your child's age and their gender. And as your child develops, it will tell you what the normal steps and normal development, normal characteristics for certain ages are. And so it can kind of help you, if you're unsure if your child may have ASD, it can kind of help you to know, is it time to go and talk to your doctor?
Yeah. And I love that app because one of the, obviously, as we alluded to before, is early intervention is key. The statistics are showing that it looks like the rates of autism are going up, but that could actually be due to earlier detection.
Yes.
So early screening, early detection is really the keystone of ASD therapy.
Absolutely. And just awareness and understanding what the characteristics of ASD are. So that way, again, you can catch it earlier.
Absolutely. And then Autism Speaks is an amazing organization.
Absolutely. It's a great, they have a lot of different resources, a lot of community options and things to explore.
Great. And then I've just popped in, we've done a whole host of webinars actually on autism. We did have a one on diet and its impact on autism, where we spoke with a special needs chef, Tinsley, which is really interesting to watch. And so I encourage all of you to go to f2fhealth.com to check those webinars out. There's a lot of great information there. We also had a blog more recently, a couple of blogs actually, on autism and diet, as well as some of the more peripheral issues around dealing with autism and parenting with autism. So Jaimie, as I mentioned, is a dietitian on our platform. If any of you would like to consult with Jaimie, please go to f2fhealth.com, go to our care section right here, and click on book care session, and you will find Jaimie online, as well as any other type of provider that you need, including OTs, PTs, pediatricians, etc. It's our vision really here is to provide collaborative teamwork for all of our children who come to the platform. I just do want to point out that next week we have another webinar, which I think is very relevant for today, helping your child deal with grief. So much stress and anxiety and so much loss in our lives at the moment with the pandemic. So I hope you can join me and Amina Tafra, who's a creative arts therapist. And again, her niche is adolescence and grief and trauma. So join us next Thursday evening for that. Jaimie, thank you once again for your time. I think we all learned so much.
Thank you again for having me. It's a pleasure.
Absolutely. It was a pleasure to have you. Again, any questions or any concerns, please go to f2fhealth.com. Have a great night, everyone.
Have a good night.